This is a simulation that gives in three-dimensional details, ocular and orbital anatomy. So all the blood vessels, the muscles, the nerves of the eye, and where they lie in position to the eyeball.
So I put these on and I'm gonna see what?
Yeah, you see the whole globe. So
Yeah.
these are the eyes, and the optic nerves move back, and that's the brain right there that
Wow.
you're seeing right in the middle where it's crossing.
That's a big eye.
Yeah, it is a big eye.
A big eye, part of a big idea. Bring a wide range of visualization and simulation tools, techniques, like this high-resolution 3D display wall, together in one place for faculty and staff to use to improve healthcare education. That one place is the University of Nebraska Medical Center's iExcel facility.
iExcel stands for the Interprofessional Experiential Center for Enduring Learning.
We are creating it from scratch. The technology is absolutely stunning in that whether it's visualization technology or whether it's the human patient simulators, it helps us recreate real-life situations before the students or the practitioners have to go into those real-life situations. So it's a rehearsal time.
Some people may use some 3D virtual reality. Some may use surgical training. Some may use simulation. Combining all those components together is very unique because it gives the learner that ability to learn in multiple different ways.
Like a mock surgical suite where heart doctors practice on a pig heart, attaching a device that helps the heart pump.
Is there maybe a touch smaller than what I used last time?
A virtual reality pupil simulator that can be programmed with rare conditions and mimics a real patient.
If you wait for about 3 or 4 minutes, the patient gets bored and he'll start looking everywhere and starts to blink. And so you have to re-instruct them. Please look straight ahead. Very good.
So I start in the right eye here, I swing to the left, and I see that the pupil dilates.
A variety of full and partial body mannequin simulators to hone lots of skills, like using another tool that provides temporary help to people having heart problems.
We want to make sure we look at all of our tools, and you'll look at echo.
And this, a digital interactive eye wall.
But you may need to have quantitative data.
Cheryl Thompson teaches a class about the management and use of patient information. It's for nurses pursuing graduate degrees and leadership roles. 6 in the room, 3 from as far away as Ireland. They can also connect with UNMC students using eye walls in Lincoln, Kearney, and Scotts Bluff. On this night, students watch and analyze videos of nurses with patients.
You want to go up and model some of that?
The patient's body is where that physical assessment information is going to be coming from.
That physical assessment is being appreciated by the nurse, so it's going into...
The other way.
Thompson has taught this class for years. It's the second time she's used the eye wall.
This way, I think it's easier for me to get ideas across because, number one, they're involved with it. As you saw, they were on the board drawing and laughing, and they weren't getting bored by me talking about it. It also can really show the movement of data, and I can integrate multiple sources.
So instead of having a bunch of pieces of paper out that's hard to track, being able to use that technology to have it all on one screen, I think that that's really innovative and groundbreaking and can definitely save a lot of time and help with the big picture.
So before, all we did was explain the theory behind it to our students, demonstrate a few videos of how it's done, and then throw our trainees into a patient room and say, now let's start doing it. This is better because now they actually get the experience of sitting in front of a patient, a virtual reality patient, and do the same thing that they would have otherwise done in a patient's room.
It's better. There's a lot less tension on the learner, so there's really time to focus and dedicate on getting that needle absolutely perfect, on getting that technique absolutely perfect before you go to the operating room, before the time matters and the seconds matter.
Now it's a matter of selling others in the UNMC world on the benefits of teaching and learning with a lot of new toys, working with faculty and staff to develop what they need.
They've taught the same way for a long time, and we're not saying that the content isn't being taught correctly and it's not being taught the right way. We're just trying to come to them with ways to enhance it and to learn in a different way. The patients are actually the biggest benefiters.
A lot of this came from the mind and experience of Pam Boyers, a medical education innovator who was once a nursing student in England. Simulation training? Students inserted tubes into the nose and throat of each other to learn the skill. Boyers learned a lot of lessons along the way. Finding better ways to practice until perfect can decrease avoidable medical errors, a leading cause of death in this country, that we need to pay more attention to the well-being of healthcare professionals, and blowing up tradition is risky and sometimes necessary when creating something like iExcel.
The biggest lesson, perhaps, is that you can't tweak at change, especially in traditional environments. If you tweak, and I have tweaked a lot, you turn and do something else. And because the tradition is so powerful, it goes back to the status quo again. So I have become absolutely convinced that the way to bring about change and the way to prepare for the future is to take a quantum leap.